Hello and welcome to Health Affairs This Week. I am your host, Jeff Byers. Before we get into today's episode, just a quick note that Health Affairs released a new issue this week. There's a lot of great stuff, including the National Health Expenditures projections from CMS. We had that as a head of print article, but now it's in the official issue. And there's an interesting article on the trends in emergency department visits and hospital capacity in the U.S., and there is a lot more. Please check that out. We also have a request for abstracts coming down the pike about health and food. Submissions open next Monday, July 8th, and submissions will close on July 29th. Check the show notes for more information on that. Today on the podcast, I'm joined by Health Affairs Meg Winchester and Kathleen Haddad. They went to AcademyHealth's annual research meeting in Baltimore and lived to tell the tale. They are going to share with us what they saw. Meg and Kathleen, welcome to the program.
Thanks, Jeff. Hello.
Hi, happy to be here.
Did you both have a good 4th of July?
It's not, never mind. Sorry.
That is right. Yeah, we're recording this on July 3rd.
I'm so sorry. Okay, blooper number one.
Yeah. For anyone that might not be familiar with Academy Health's meeting, can you just explain what the annual research meeting is, what its purpose is? Why do health policy wonks of all kinds convene to Baltimore in the sweltering heat?
Sure, yeah. Well, the annual research meeting is the main conference that Academy Health sponsors, and Academy Health used to be focused on health service researchers and has broadened over the decades its reach to anyone who works in health policy in a broad sense. So the research meeting is organized around 21 themes. They run from Medicare, Medicaid coverage and access, mental health and substance use, social determinants, women and gender health, structural racism, and some method sessions. And there's an elaborate process that Academy Health uses with the reviewers from all stripes to select abstracts. They organize the sessions mainly into call for abstracts where the reviewers in their committees, subject committees, will organize a session. And then there are some sessions that are research panels, fewer, where the researchers or presenters themselves organize their own session and submit that to Academy Health. So, and then Academy Health itself says, I saw a blog, and it says, Academy Health blog, the ARM agenda is finished off with a pinch of career development sessions, a dash of method sessions, and a smidgen of plenaries and other invited special sessions. So there you have it.
Well, we're going to have to get the name of that copywriter. Well, thanks for sharing that information. So that is a lot of different topics. We're not going to be able to cover everything, and you all didn't attend every meeting, from at least not that I'm aware of. So what struck out to you when it came to some of these sessions?
I can start with, I went to the opening plenary on Saturday, and Dr. Aaron Carroll, who's the new president and CEO of Academy Health, kind of set the stage for the conference. And I was really impressed that he was talking about finding solutions, that everybody in that room was really good at finding issues with the health system and, pointing out things that didn't work. He was kind of making it a call to action for people to focus on solutions. And that really wove throughout the conference. I saw it in a bunch of other panels that health services research can be a little bit quantitatively oriented sometimes, and not always engaging with the community or with theoretical models. But I found, and I was really impressed by the number of sessions that talked about the need for collaboration and community partnership and had some really good examples of the work that people were doing.
That's great. Yeah, Aaron Carroll, I know, is a New York Times columnist. So that's, as some might know, journalists love to point out problems, and there's not always a solution to be had. So that's really interesting. And, it makes me wonder from a health affairs perspective, while you all are editing, to the extent that you can answer this question, when you're editing a paper, do you all look for a solutions focus in the research articles while you're editing them?
Yes, we do. We, as researchers know, every paper needs to have a section on policy implications. And we at Health Affairs stress that. And the policy implications have to flow from the findings of your paper. It just can't be starting out on another topic or related topic because you want to advocate that. But Meg, what do you find when you're editing?
Exactly the same. We find a lot of good work that has to link to policy in some way. And so sometimes that lends itself to a set of recommendations, proposed changes or solutions, going a little bit beyond just calling for more research. I think health affairs papers take it a step beyond that.
And I just love to hear that solutions-oriented type of approach in general. And it seems like that was a big theme throughout the conference. Did it seem like the attendees or other researchers that you came across, like how did they take that message?
My sense on that question is Academy Health Services research community has really evolved to that focus on let's find out what the data show us both quantitatively and qualitatively. They're both important. And then let's examine what solutions flow from that. And everyone really appreciates the need to focus on solutions, even if their research is focused on something more methodological. The community has absorbed that need. And I do think that, especially health affairs, lays out the agenda that policymakers, legislators, regulatory leaders read and listen and look for solutions there.
So that sounds great. From a subject matter area, were there any breakout sessions that you went to that you found interesting?
I went to several sessions. The one that intrigues me most was the one on private equity. There were several sessions on private equity. And I can talk for a while on private equity. I will try not to here, but in this session, it was about the impact of ownership, specifically private equity, and then market concentration on healthcare utilization, on quality and fraud, focused on those first two outcomes, utilization and quality. There was researcher Jean Zhang, I think I'm pronouncing that correctly, from Minnesota, and who studied about 100 PE acquisitions in home health agencies. The takeaway from that is that PE firms who buy home health agencies tend to adjust their service areas to attract more profitable enrollees, generally Medicare enrollees rather than Medicaid enrollees. And another important study in that session by Sneha Kannan, if I'm pronouncing her name correctly, from Harvard. She gave a good overview in her talk on how PE works in healthcare, and investors generally working through a PE firm put very little of their own money at risk. And so they'll buy a healthcare provider and most of it is debt. And so that puts the provider, such as Hahnemann Hospital in Philadelphia, under pressure to continue paying a ton of debt. And finally, as you know, Hahnemann closed. And so she found that studying about 400 acquired U.S. hospitals, that staffing in the CCU, critical care unit, and the emergency department declined. There was a slight rise in mortality compared to non-acquired hospitals, and that transfers rose from ICUs and EDs. And she concluded that the PE focuses more on cost-cutting as profit-making strategy more than revenue-generating activities such as adding services. And so that's why volume reduced, because there are certain requirements for nursing staffing in state and federal law. And so there's a huge implication for the care of critically ill people in PE-acquired hospitals. She suggests, or another researcher then wound that up, Zeri Song, who's a preeminent researcher on private equity, was at this session, gave a talk more on methodology. So I'll skip him for now. But the final speaker focused on some solutions, since we were talking about solutions. And We have a paper that I think we just published by Zuri Song and Chris Kai on policy solutions for the private equity issue. And this researcher focused on some of those, increasing the tax on PE income, which is now treated as to be nerdy carried interest. And so it's only taxed at 20%. That can change and help slow this down. He said the moral hazard issue has to be addressed, where requirements for more investor money have to be part of PE deals so they have more skin in the game. And the FTC is starting to look at stopping the continued gradual acquisitions. For instance, if you buy a medical practice, you won't stop at one. A PE firm, you'll want to buy the others in a market. So trying to slow that down and stop. The issue with solutions, though, is the political will. So that's the next topic.
Okay. Yeah. And just really quickly, that Christopher Kai, Zuri Song article is on our May issue. It's called Protecting Patients in Society in an Era of Private Equity Provider Ownership, Challenges and Opportunities for Policy. And it's really interesting that you mention the patient outcomes or transfers. Like there hasn't been, as far as I can tell, a lot of impact papers or a lot of impact on quality or outcomes, patient outcomes when it comes to private equity. There is a lot of research, a lot of it published on Health Affairs regarding of what happens to costs and prices for patients. So that's really interesting to hear. At least that's something new I haven't heard a lot of.
Yeah, I think Zuri Song and his team at Harvard and others are really starting to get into that.
And Meg, you're at that session too, is that right?
I was, yeah. And I echo all the things Kathleen said about that. But I had to run at the end of it to go to our Health Affairs booth, where I met a whole lot of podcast listeners. We actually had someone come up to us and say that she listens to this podcast when she brushes her teeth.
Okay. Well, good morning.
Yeah. Shout out.
Or, good night, depending on when you're brushing your teeth.
Well, you can also listen while you're cooking, right?
Yeah.
And driving.
Yeah.
Doing lots of things.
Good morning, good afternoon, good evening.
A few of the other sessions that stood out to me included one on measuring structural racism that was very deliberate about ways to operationalize health equity. And it overlapped a fair amount with another session on equity in accountable care. And that one had a few shout outs to our ongoing Forefront series on accountable care, which is very exciting. But they were talking about lessons learned after 1 year of some of the new value-based payment models and some of the ways that federal agencies are coordinating to figure out how best to pay for equity and how to reimburse and measure it in models, and then how to scale that over time. And we're still in the early days, but it seems like they're being very deliberate and it's optimistic.
Well, thanks. As we wrap up this conversation, is there anything else that you both want to highlight that you thought was interesting from the conference?
Jeff, there were so many sessions on so many good topics. I did go to a few sessions on substance use and opioid use. And one that stuck out was one where administrator or the head of a program called Be Well Texas talked about how there was nothing in Texas to help substance users, not nothing, but very little service, and how they scaled up some incredible programming against odds of, Texas not having very helpful legislation or laws on what kind of medication treatment you can provide. And over 4 years, they scaled up a program that I think others should look at called Be Well Texas, reaching areas of that huge state. There were a few others on that topic too. And that's it.
So this was my first Academy Health meeting. And in my previous life, before I was an editor, I'm an anthropologist.
Oh, wow.
And so my big takeaway was that anthropology has a lot more in common with health services research than I realized. That there's a lot of space for qualitative work and community engaged work. And, going back to some of the solutions focused work we talked about in the beginning, it warmed my anthropologist heart to see all of the diversity of voices and things going on at Academy Health.
Well, fantastic. Meg and Kathleen, thanks for giving us your scene report with your eyes and ears onto the health policy streets out there in Baltimore. Appreciate the time and appreciate you coming on to Health Affairs This Week. Listeners, hope you enjoyed the episode. Check out the show notes for pointing to the RFA and some of the research that we mentioned, and have a great weekend and see you next week.